702 Weekend Breakfast. Healthy living.
11 minutes after 6 o'clock, it's time for us to get into a healthy living conversation this week. I stumbled upon a video a couple of days ago of an American dermatologist, I think it was, who was saying, actually, you shouldn't be putting perfume on your neck, which is one of the places I put my perfume. I've been doing it for many, many, many years, as I'm sure many of you have been doing as well. It's one of the first places we learn to put perfume. And she was saying, actually, by doing so, you can cause something called fragrance-induced pigmentation. So we thought, this is interesting. Let's unpack this a little bit. So this morning, we are joined by Dr. Maureen Elim. They are the founder and medical director of Skin Renewal. We also take your calls on 011-883-0702. Send us SMSs on 31702 and your WhatsApps on 0727021702. Dr. Elim, a very good morning to you. Welcome to Weekend Breakfast.
Good morning, Dirk. Great to be here.
Thank you so much
Bright
for your
and
time.
early.
Yes, bright
Yes.
and early. Thank you so much for your time. So,
Pleasure.
Doctor, we are looking this morning at, so what happens to our skins when we use, for instance, perfume on our necks? And what is Poikiloderma? I hope I'm saying that correctly.
Correct, yeah.
So start us with what is Poikiloderma when we're speaking about that particular condition?
Okay, so Poikiloderma observate, it's a skin condition. It's a dermatosis, which you see more, so it's more common in light skin patients. You do get it in the darker skin patients, but because of the pigment, you don't see it as much as you would in a light skin patient. So what is a giveaway sign is that where your chin, the center of the neck, where the chin covers the neck, so it's got a constant sun protection, you'll find that it's much lighter and normal skin. But as you get, laterally towards the sides of the neck, you'll find that skin is thinner, it's red, so it's not only brown pigment, there's also red discoloration, reddish discoloration. And there's a fine reticular pattern of veins that occurs in this area. So it's a combination of, color, and it's got, so it's very, sun-damaged skin, which we call solar elastosis, and that's what causes this redness of the neck. And then you also find it you can get it on your cheeks, and sometimes even going down in your chest. So it's just chronic sun damage on skin.
Right.
And, years ago it was a myth that it was due to perfume, but now they're realizing, they've actually done studies where they've used different perfumes and they've noticed that the perfumes cause like a dermatitis, and then you get like inflammation. And once you get inflammation, then you get pigmentation. Right. So it's chronic inflammation. And they've also realized that since 2005, there are two preservatives in even skin products that can cause it. So they've got very long names. So I'm going to call them MI and MIC. And they always used to be in combination. And since 2005, the MI, can be used on its own. And that's why you can get this chronic sun damage, because our UV index in South Africa is much higher than anywhere else in the world. So the southern hemisphere, South Africa, Australia is very much, it's much higher than, the northern hemisphere. And then chronic exposure, chronic sun damage can cause this poikiloderma. Mm-hmm. And they've even found that certain creams with these preservatives can cause it, So just make sure you don't have the MIC and the MI, if you are suffering from that.
And so, in addition to, I guess, the chemicals, like certain preservatives, certain perfumes, certain cosmetics, as you were saying, Doctor, and also having fair skin, is there a genetic component at all?
Yes, it's also genetic. You'll find it does run in families. So there's a genetic component, as well.
And so, and are there potential, if you are perimenopausal, menopausal, can that impact your risk of developing this poikiloderma?
So poikiloderma, funnily enough, they say sometimes when you put, like menopausal, when your estrogen's, lowering, because estrogen is the anti-aging hormone that stimulates collagen and elastin. So when when your estrogen starts declining, you'll find that your skin gets thinner and more vulnerable to poikiloderma. But this is more, but it's more chronic exposure. Most of the sun damage occurs, before the age of 20. And then it's slowly, if you continue exposing your neck, you'll find that it just deteriorates as you get older. The pigmentation anywhere on the face deteriorates.
We're often told that, one of the great forms of defense to prevent, pigmentation and general damage to your skin, obviously not all skin conditions, but to give yourself just a, pretty solid baseline of protection is sunscreen. Does sunscreen have any role to play in minimizing the risk of developing poikiloderma?
Yes, absolutely. Putting the sunscreen on your neck, and make sure that it's got a UVA, UVB protection of at least 30. Some dermatologists reckon that you should have a 50 UVA, protection, UVA, UVB, because UVB is the burning ray, and UVA causes the sun damage, which, breaks down the collagen and elastin in the skin. So that's the aging ray, and UVB is the burning ray. And both of them can cause skin cancers as well. So it's very important, in the morning, because, we put on our face sunscreen and our products, but we always seem to neglect our neck, the neck and the chest. And if you look at a person, that is actually your face. That is what's exposed, because normally you're wearing clothes, so you don't really see your arms and your shoulders, but your face, your neck, and your chest are your face. So don't forget to, put your anti-aging creams and your sunscreens on your neck and your chest as well. Smooth it down into those areas. And then obviously add sunscreen to your neck as well and your chest.
Doctor, as I was, I guess, preparing for our conversation, I read a piece that said, in fact, what's recommended by some medical professionals is that we should not be wearing perfume if we're going to be exposed to the sun, no matter our skin type. Obviously, the neck area being quite a big sensitive area, but is that the kind of advice we should be following? Not to wear perfume in the sun.
Yes, that's, because, years ago I stopped, spraying the perfume onto my neck when I became aware, 20 years ago when I became aware of poikiloderma.
Yes.
And, now I put my perfume on my wrist, because that's one of the hot, the warm areas. And very often I just spray it on my clothes. I don't really, allow perfume, the fragrances. So with all the parabens and the phthalates and all these pesticides that cause estrogen dominance. So I don't, just put it on my body. I just spray my perfume on my clothes. Just like a light touch, not, excessive. And then try avoid putting it on your neck, because that can irritate the skin. That together with sun damage is going to perhaps cause that poikiloderma.
Yeah. And so could you continue, for instance, some people put perfume on their clothes or in their hair. Is that fine if you're trying to, prevent poikiloderma, but you still want to smell, wear your favorite perfume?
Yes, absolutely.
So
I just give a quick spray down, in fact, lower down. So it's there, but it's not excessive, and it's not on the body. We don't really want it on the body, on the skin.
Yeah. And doctor, if in the instance you are then diagnosed with poikiloderma, what is generally the course of treatment? Is it a thing that can be treated? Does it then become chronic once you're diagnosed?
Okay, so once you've been diagnosed, you just want to make sure that it doesn't get worse with time. So then you start, you can get a medical cream. You can go to your GP and get a medical cream that you put on. Or you can go to one of our skin clinics where we give you something called azelaic acid, which is incredible. It's a powerful, it's a powerful anti-inflammatory for all skin conditions: dermatitis, poikiloderma, rosacea, acne, and you put that on daily, and that stops the inflammation happening. And then you would need a few skin brightness or lightness. So you need products that contain active ingredients that block the formation of pigment, and then you should repair the barrier, because most of our skin conditions come with impaired barrier. So it should have active ingredients that are going to repair the barrier, and then moisturizer. Moisturizer with shea butter, glycerine, all those, to protect the neck, and then obviously your sunblock. So it's a slow process. You've got to put topicals on, which will slowly decrease, but you're never going to get to a point where it's going to be, a perfect skin. And that's where all the in-clinic treatments like IPL come in to treat the red and the brown of Poikiloderma. So that's what IPL does. And then, so we use a combination of limelight, which is IPL, a superficial chemical peels. And then we also have something called RF needling, which is hot microneedling. And that is quite incredible how it reduces pigmentation, stimulates collagen, and then also destroys those senescent cells in the skin. We call them, they're like zombie cells that haven't died off due to the chronic sun exposure. And you need to get rid of those cells because those cells cause havoc in the skin. They interfere with the normal function of your normal fibroblasts and your melanocytes. So a combination of peels, IPL, and RF needling, or anything that's going to improve the collagen in the skin is going to help, together with something that's going to slowly lighten skin, bring it back to where it was before. But it's never going to be back to where it was before. Right. But just lighten it that it's not so obvious.
And speaking of, I guess, sort of brightening and lightening your skin, there are a number of like miracle products that have become very popular. There, the AHAs, the BHAs, the niacinamides, the glycolic acids, the salicylic acids. Can any of those active ingredients also contribute to Poikiloderma? I know as someone who uses niacinamide, the bottle says, to wear sunscreen because the use of the product can increase sensitivity to the sun. Same with retinol. So can the use of some of these products, which are really great for various skin conditions, can they increase your risk of
pigmentation?
Yes.
Yes. You know why? Because those products, those active ingredients exfoliate your skin. Right. So they take that top horny layer off. So your skin's got different layers. So the top layer being the thin cells that protect you and reflect the light off the skin. So if you're going to be doing any of these products which are peeling agents, especially the lactic, the salicylic, the glycolic, you will find that if you do not protect the skin with the SPF and products, you will find that you can slowly over time get pigmentation because it's not protected. And even just sitting in a room with light, ambient light, that is, affecting the skin, stimulating those cells to make pigment. Okay, so that's why it's so important to also include your SPF on your neck, and especially if you're using those active ingredients.
With regards to children, doctor, are they at risk of developing Poikiloderma, or is it a thing we more likely or largely see in older patients?
Look, as I said, we expose most of the sun damage occurs before the age of 20, and then it just gets progressively worse as we get older. And that's when those zombie cells start playing up and causing melanin, and you break the skin down. So it's always the best to actually protect children, because it's vital that you protect your kids against the sun, especially in South Africa, where the UV index is so much higher than anywhere else in the world. And in summer months, because of the elliptical orbit of the Earth, we get closer to the sun, and that's why, it's so vital you protect. And then there's also, over the Antarctica, there's a hole in the ozone layer that protects us. So it's especially important in summer. And then, so what you should do is not have your children play outside, definitely between 12 and 2, but the safe periods are between 10 and 4. So between 10 and 4 those are the times of the day when the UV index is very high, especially between 12 and 2. So just make sure that your kids are protected if you're allowing them out. But I wouldn't allow my kids out, especially between the times of 12 and 2, because that's when the UV index is at its highest.
Yeah. And, speaking of kind of safety in the sun, of course, we're experiencing warmer weather. Many of us are getting ready to spend more time outside, people swimming, playing outside. in addition to ensuring that, kids aren't outside during those, that hottest part of the day between 10 and 4, what are other precautions we should be taking as the weather gets warmer for both children and adults?
I guess you get that, protective clothing. And, I see you get these bathing suits for children, which are protective. They have the special UV protection factor in them. So I think it's 84 and 94% that you have to have. And then thick woven fabric also protects better than very thin, flimsy fabric. So make sure that they're well covered if you're not going to be applying enough sunscreen on them. And then once again, you apply the sunscreen, make sure you go 20 to 30 minutes before you go outside so that the sunscreen has taken effect. And then just keep them well covered. Don't let them run around, like bare-chested, and, make sure that they're well covered with clothing if they are going to be out in those hot times of the day. And if you're an adult, what you can do, if you're outdoor sports, there's also an internal sunscreen that you can take, which are normally powerful antioxidants. So that protects you from the inside, but it doesn't give you, it doesn't protect you. You still have to put your SPF on, but it gives you that extra protection because it raises the level of when you first going to become red. It takes a bit longer to become red, but it definitely protects as well.
Yeah.
But it's not, yeah.
I was going to ask, Doctor, and if you're spending time outside, as many of us are going to start doing, if we're not doing it already, how do you know that you need to get out of the sun? Because not everyone peels when they get a sunburn. Not everyone, for instance, with a darker skin, it can be a little bit difficult to see because your skin won't go red in the way that it would if you have a fairer skin. So what are some of the signs that you've spent just a little bit too much time in the sun? You need to go inside. And what do you then do to try to treat that burn?
So after like 15 minutes, you'll find that your skin starts reddening, and that's when you know that now this is the maximal dose of sun that you can have. But very often we carry on, and, eventually you're going to become super red, and depending on your skin type, if you've got lighter skin types, you're going to burn. It depends how much melanin you have in your skin. So the darker skin types won't really feel won't burn as much and won't feel it as much because they've got natural SPF built within their skin, from the melanin. But once you've had that sunburn, you have to calm it down, and normally you can put antioxidants on it like Pigmentation. We've got something that you can put on that actually calms the burn down. So the best part of this is actually prevention and being aware that if you're going to be in the sun for longer than 30 minutes without any sun protection, you are going to burn. And that's why, and you have to keep applying after every 4 hours, applying that SPF because it's not, it doesn't last all day. Mm-hmm. And if you go for a swim, you have to towel dry and then reapply it again.
Yeah. And with regards to some of the products available at Skin Renewal, are any of them able to assist with hyperpigmentation, Poikiloderma, some of the conditions that we've discussed this morning?
Yes, so like I said, the one, the azelaic, we've got, products that have got the pigment brightness in it. We have many products and in-clinic treatments to deal with pigmentation, like melasma. And you get different kinds of pigmentation, like in women, and we've also found it in men. You get the hormonal pigmentation. Very often it's previous sun-damaged skin, and then you have, you start taking hormonal contraception, and then that fuels the pigmentation, and you find that from like 28 to 30, or when you're pregnant, you'll find that your skin starts developing this pigmentation, and that's hormonal pigmentation. And that's once again driven by inflammation. And that's treated slightly differently from normal pigmentation, which you can get post-acne or, sun damage. And that normally occurs, sun damage pigmentation that you start getting these spots on your skin starts normally happening after the age of 40. Mm-hmm. Because of those zombie cells in the skin that now start, affecting normal pigmentation. It starts making these little, increased abnormal melanin in the skin. So there are many treatments that we can do. We have many products, got a whole range of products that we have And then obviously you get the gold standard of products, which is, Kligman's Luma, Hydroquinone, which can only be prescribed by a doctor, and that it has to be very strictly controlled, because you cannot indefinitely put the hydroquinone on the skin, because then you can land up with a condition which is very prevalent in South Africa. Fortunately, it's less now these days because hydroquinone is so strictly controlled, called ochronosis. Mm-hmm. You know, the chubabas, when you get those dark marks in the skin,
yes.
Because if you use hydroquinone and you don't put SPF on and you're out in the sun and you do it for prolonged periods, you will eventually get, darkening, paradoxical darkening of the skin, called ochronosis. So, a hydroquinone can only be prescribed by doctors, and we combine it with other products so that you're not, so in between, so we normally limit it to 3-month periods, once or twice a year. And then in between we use the other brightening products to help control pigmentation, together with always SPF.
Doctor, I must thank you very, very much for giving us your time this morning. A great pleasure having you on the show.
Thank you. Thanks, Brooks.
Thank you so much
Bye.
for your time. That is Dr. Maureen Elam. They are the founder and medical doctor of Skin Renewal, joining us for a healthy living conversation this morning.